After deciphering two paradoxical presentations and treatment protocols of fatty liver in the previous videos, let's now have a glance of the considerations that are to be made by an authentic Ayurvedic Vaidya while diagnosing and treating a case of hyperlipidemia, which is often considered as a Medovahasroto Vikriti in Ayurvedic clinical practice. Hyperlipidemia is an abnormal biochemical variation observed in blood, characterized by elevated levels of lipid or fat in blood. So, should this be endorsed as elevated levels of medas in Rakta Dhatu according to Ayurveda? If yes, what are the causes of this abnormal biochemical variation in Rakta Dhatu according to Ayurveda? To know this, we'll have to first understand about the requisites for physical and biochemical normalcy of any dhatu, be it Rakta or any other dhatu, according to Ayurveda. The factors are as follows. Prakrita Jataragni and Bhutagni is the primary prerequisite for normalcy of all dhatus of body as it produces normal Ahara Rasa or Poshaka Rasa. Prakrita Vata is required for proper Vahana of dhatus. Prakrita Srotas with Prakrita Dhatvagni is required for proper Dhatu Paka to happen in the body. And Prakrita Avastha of dhatus or dhatu from which a respective dhatu is produced is also very essential for proper dhatu parinamana. And also Prakrita Poshaka Rasa is very crucial for normalcy of all dhatus of body as it nourishes all dhatus of body. I mean to say, impairment in any of these factors or all of these factors will cause physical or biochemical variation or both physical and biochemical variation in dhatus of body. And hyperlipidemia is an abnormal biochemical variation observed in blood, that is Rakta Dhatu of Sharira. As this is a biochemical variation observed in blood or Rakta Dhatu according to Ayurveda, we'll have to now understand the causes of abnormal biochemical variations in Rakta Dhatu according to Ayurveda, which are as follows. Vikrita Jataragni or Bhutagni might produce Sama Poshaka Rasa, and this might affect the biochemical composition of Rakta. Vikrita Vyanavata ending up in Asamyak Vahana of Rasa Rakta might cause impairment in Rakta Dhatu. Vikrita Raktavaha Srotas with Dhatvagni impairment might cause Vikrita Rakta Dhatu Paka ending up in biochemical variation of Rakta. Vikriti in the Rasa Dhatu Bhaga from which Rakta Dhatu is produced might cause Vikrita Rakta Dhatu Utpatti, leading to biochemical variation in Rakta. And Vikriti in Poshaka Rasa might cause Asamyak Poshana of Rakta Dhatu, causing a production of Sarahina Rakta Dhatu, reflecting as biochemical variation in Rakta Dhatu. And coming to today's topic of concern, that is the Ayurvedic perspective of hyperlipidemia, meticulous analysis of physiological properties, functions, and pathological effects of lipid as described in Western medical science makes it clear that lipid is a Sneha Guna and Guru Guna Bhoishta entity. Hence, hyperlipidemia, that is abnormally high levels of lipid in blood, would be considered as abnormally high levels of Sneha Guna and Guru Guna in Rakta Dhatu. To be more precise, the causes of abnormally high levels of Sneha Guna and Guru Guna in Rakta Dhatu, according to Ayurveda, are as follows. Sama Poshaka Rasa caused due to Vikrita Agni, that is Jatar Agni or Bhuta Agni, might give rise to excess Sneha Guna and Guru Guna in Rakta Dhatu. Kapha Pitta Dushta Rakta, along with or due to Vikrita Rakta Dhatvagni in Rakta Srotas, might give rise to excess Sneha Guna and Guru Guna in Rakta. Vimarga Gamana of Kupita Vata might drag Shitila Dhatus to Rasa Rakta as in Vataja Prameha and might give rise to excess Sneha Guna and Guru Guna in Rakta Dhatu. Shitila Abadda Dhatus of body might have entered into Rasa Rakta, example Medas, Mamsa, etc., as in Samprapti of Kafaja and Pittaja Prameha and might lead to excess Sneha Guna and Guru Guna in Rakta Dhatu. Excess Kapha or Pitta or excess Kapha and Pitta in Rasa Dhatu might give rise to excess Sneha Guna and Guru Guna in Rakta Dhatu. Excess Kapha or Pitta or excess Kapha and Pitta in Poshaka Rasa might also give out excess Sneha Guna and Guru Guna to Rakta Dhatu. So any of these or all of these might end up in producing excess Sneha Guna and Guru Guna in Rakta Dhatu, which usually gets reflected in the form of hyperlipidemia. And the treatment of hyperlipidemia goes so based on these causative factors. Dipana and Pachana should be the line of treatment when the cause is Agni Dushti, giving rise to Amutpatti. Rasa Dushti Hara Chikitsa, that is Dashavida Langana, any of that based on the condition should be the line of treatment when Rasa Dushti is the cause for excess Sneha Guna and Guru Guna in Rakta Dhatu. Rakta Dushti Hara Chikitsa explained in Vidhishoniti Adhyaya of Charaka Samhita should be the line of treatment when Rakta Dushti itself is the cause for excess Sneha Guna and Guru Guna in Rakta Dhatu. Prameha Hara Chikitsa should be the line of treatment when there is presence of Abadha Dhatus in Rasa Rakta, into giving rise to increased level of Sneha Guna and Guru Guna in Rakta Dhatu. So while this was about the considerations that are to be made by an authentic Ayurvedic Vaidya while treating a case of hyperlipidemia, this is the reference from Charaka Sutra 28th Adhyaya from which today's analysis was majorly made. Thank you for now. We'll get back to you with another new video soon. Thank you.